Hi, my name is Daphne Ochoki, and today I'll be presenting about measles. So the objective that we have, the first one is to understand the pathology and pathophysiology of measles, to explain the mode of transmission and epidemiology of measles, to identify the signs and symptoms of measles. Four is to describe the diagnosis of measles, as well as to outline the management of measles, and lastly, to understand the preventative measures against measles. So here I'm going to be talking about what is measles, and measles is a highly contagious viral disease that is spread through the respiratory droplets. It typically starts with fever, cough, runny nose, and red eyes. It's followed by a widespread rash. So measles can lead to serious complications such as pneumonia and encephalitis. It's preventable by the MMR vaccine. This helps in curbing and preventing measles outbreak. So it's very essential to have this immunization. Under epidemiology, we talk about how it affects people at large. So it's mostly commonly affects children. It can also affect a person of any age, but mostly it's majorly on children. Most infants less than 6 months are usually spared due to passively acquired antibody. We have measles is highly contagious and spreads through respiratory droplets. And to remember, this should not be confused with a generally milder childhood rubella. So measles has also been known to cause about 15,000 to 60,000 cases of blindness per year. So if not caught early, it can really cause major blindness, which is not something we want. So under this slide, we're going to be talking about the pathophysiology. Following transmission, viral replication proceeds in the upper respiratory epithelium. It causes cellular damage and cell fusion with formation of syncytia. First, viremia is seen on the second or third days. The virus then spreads via lymphatic dissemination to distant sites, including lymphoid tissues, abdominal viscera, and the skin and bone marrow. Another episode of viremia occurs on the 5th to 7th day. Systemic symptoms occur with viruria persisting up to 4 days after the rash appears. So how do you spot measles? The signs and symptoms. We have Koplik spots, which are white spots with central bluish specks on the upper lip and cheeks. Koplik spots appear about 2 to 3 days before other symptoms as mentioned above. These symptoms persist for about 4 days but may progressively worsen. A rash then develops during a 4-day period from the forehead to upper extremities, trunk, and lower limbs. However, no rash appears in patients with defective cell-mediated immunity. Nevertheless, the virus may invade other organs in these patients. So how do you diagnose? A diagnosis of measles can be made using clinical features. However, lab confirmation may be necessary for public health and outbreak control. Serologic testing for IgM and IgG antibodies. Isolation of the virus using culture and rapid diagnosis through polymerase chain reactions, which is PCR, are common evaluators or evaluations. A complete blackout may show leukopenia with lymphocytosis and thrombocytopenia. LFTs may reveal elevated transaminase in measles hepatitis. A chest radiograph and lumbar puncture may be conducted in suspected complications. And what are these complications? Complications could be the middle ear infections, pneumonia, blindness, mesoencephalitis, and severe diarrhea with dehydration. What are the treatment options? Under treatment, there's no specific therapy for measles. Patients usually receive supportive care with most requiring hospitalization. Adequate hydration is necessary, with some requiring IV fluids due to dehydration. Febrile patients are usually managed with standard antipyretics. Also, vitamin A supplementation is necessary, especially with those who have deficiency, because deficiency in vitamin A is associated with this disease or severe measles. Measles vaccine for post-exposure prophylaxis is usually preventive if administered within 3 days. Lifelong immunity is associated with neutralizing antibodies. Under prevention and control, vaccination is the most effective preventative measure for measles. It's given as part of the MMR, which is measles, mumps, and rubella, with the first dose at 9 months, second at 15 to 18 months. The 2 doses offer lifelong protection. Additionally, vitamin A supplementation reduces the complications of measles. Early identification and surveillance are important to facilitate quick public health responses. Health education is also crucial. What is the role of an APN? APN should educate individuals, families, and communities regarding measles, its signs and symptoms, transmission, and importance of MMR vaccination. The APN has a duty to safely administer measles vaccine safely to patients while maintaining accurate and up-to-date records. The APN should report any suspected measles care as well, or measles cases. Furthermore, the APN should advocate for strong immunization policy and collaborate with multidisciplinary teams during outbreak for better planning and response. Here are the references. Please review. Thank you so much.